Good morning. Welcome to our second in a series of Cornerstone carrier events. And this morning we are pleased to have the Anthem team with us. They're going to cover a wide variety or a gamut of topics this morning from all segments. So we'll have a lot of great information for you, starting with a couple of housekeeping items. If you have a question throughout the presentation, go ahead and type it as you think of it in the question box, and we're going to answer as many of those questions as time permits at the end of the presentation. I am Shelley Brownell, the Senior Director of Employee Benefits in Southwest Ohio here in Cincinnati, and will host several members from the Anthem team, and we'll introduce them in just a moment. Wanted to remind you of a couple of programs that I think you've probably heard much about from us. Autopilot, especially this time of year for folks who are not in the individual Medicare arenas, but have clients that they need to refer over to us. We encourage you to call this number. Sit back and let us do the rest. Or if you're a broker who is giving consideration to retirement, we certainly would love to hear from you also, and we can discuss the features of those programs with you. We also have our Earn Cash with Cornerstone contest going on, an incentive program. The top qualifier receives $5,000. Second place, $2,500. Third place, $2,000. Fourth place, $1,500. There is a lot of detailed information about that on our website, crnstone.com. You earn points for new business written in 2020, and the qualifiers will be announced early in 2021, and one lucky qualifier will win a weekend getaway. If you are not registered, you still have time. We encourage you to go to crnstone.com/2021-incentive to get registered. If you are not registered, we cannot calculate your points and put you in the running. So don't wait to do that. Time is slipping by here as we enter fall. This morning, as I mentioned, we have the Anthem sales team with us, a variety of different areas represented. We have Kathy Shiplett, who is the Southwest Ohio Small Group Account Executive, Robin Kopp, who is the Southwest Retention Representative. Matt Lapp is our 51 to 99 Southwest Account Manager for Retention. Jeff Reed, who is up early with us this morning in the North, is with the Connect team and the Specialty Benefits area. And then Nicole Caton, also in Southwest Ohio, with Specialty Benefits. So we'll go ahead and turn that over now to Kathy, and we will begin the presentation.
Thank you, Shelley. Good morning, everyone. Just to verify, you can see my screen okay?
Yep, looks good.
Okay, perfect. Thank you, everyone, for joining us. We have a lot of information to share with you today, so I'm going to jump right in. And we will get started. So today we're going to be going over changes in products and programs that apply to the 2 to 99 segments of business, followed by 2 to 50 updates and 51 to updates that apply just to those segments. So let's start out by looking at the tools that we have, our digital enhancements to our broker tools. The first one I want to talk about is our Broker Plus app. This can track applications, receive timely messages, and view new sales, retention, commissions for any individual, small group, and Medicare markets that you work in. As we enhance this experience, you will also see large group and specialty added to this app. You can download the Broker Plus app from the App Store in your mobile phone. And for every Broker Plus app downloaded, Anthem will help to provide 80 meals to families in need through the Feeding America network of food banks. So please take a look at this. It's a great application that will be very useful, I think, in the fourth quarter. Also, if you haven't reviewed it lately, our producer toolbox has been redesigned, and you can find a lot of marketing materials out there that were not available previously. So let's look at the employer tools that we have enhanced for 2021. The first is the benefitsguide.com. This is the online resource to help employers to see the total picture. It's Anthem's digital presence brings employers the resources they need to stay informed. They can access employer-focused content, including videos, infographics, quizzes, and health-related articles. Returning users to this site now make up more than 30% of the traffic, and over 3 million views have come from employees across the nation. Some of the information that is accessible on here is our Employer Coronavirus Resource Center. In this section, it includes some of the updates that we have made recently, such as telehealth cost share changes. As of September 30th, the Anthem cost share waivers will be for video only. The cost share waivers that are for video only telehealth will expire September 30th. So starting October 1st, Anthem members will pay the usual cost share for the visual telehealth visits with in-network providers. Anthem will continue to cover in-network telephone-only visits at no cost share through the end of the year. And this follows suit with Live Health Online as well. The regular cost share will go into effect starting October 1st. The other piece that relates to COVID is the eligibility requirements will continue to be relaxed through the end of the year. So our requirement for employees to be actively working in order to be eligible for coverage will continue to be relaxed through December 31st, 2020, as long as the monthly premiums are made. Anthem will also allow to have a reduction in hours, so those that are working less than 30 hours a week can continue the coverage also through the end of this year. Passport, powered by doc.ai, is a self-reporting tool designed to monitor and trace employees' health to assess if they have symptoms of COVID or may be recently exposed. The results can be used to help decide if they are approved to enter the workforce and can help employees by minimizing exposure to others who may be potentially infected. If you have a group that would be interested in utilizing this tool, please contact your Cornerstone rep and we can get you signed up for a demo for your group. We have also pooled resources together for consumers, and they are available at anthem.com/recovery. And this covers such areas as mental health support, community resources, and caregiving. Now let's talk about Anthem's member engagement and digital solutions. Anthem Skill is our new voice-activated health assistant using Alexa. With Anthem Skill, members can simply say, "Alexa, ask Anthem to." It could be order an ID card, check your health savings account, check your deductible, out of pocket, find a doctor, refill, renew, or check the order status of a home delivery prescription. You can find out how close you are to reaching your dental plan's deductible or annual maximum. And coming soon, members will also be able to say, "Alexa, ask Anthem to access claims information." Members can download the Anthem Skill by going to Skills and Games on the Alexa app and search for Anthem Skill. The Sydney Health app. This is a whole new level of healthcare connection. Members can have a fully integrated hub for information about their benefits, making it easy to stay connected to their health plan and their health. Sydney Health uses AI to deliver a personalized experience for each member. They can check benefit details and claims information, compare costs for healthcare services that are based specifically on their healthcare plan, search for doctors and healthcare professionals, connect directly to virtual care options, access and use their Anthem ID card, explore health and wellness programs, and join in wellness challenges. New in 2021, Sydney Health will add virtual care features, including the AI symptom checker and the opportunity to securely link virtual care visits with doctors using text, chat, and video visits. My Health dashboard is on the Sydney app, and this is for groups that have plans that include incentives. This would be SACA Link, which we will be talking about soon, ACA plans that include incentives like the Plus plans, ACA Link plans, and the key plans that include Get Strong. These members will receive points for different activities, such as logging into the website, connecting a tracking device, completing the WebMD health risk assessment, reading articles, watching videos, setting an action plan, completing an action plan, and tracking steps. Our Smart Shopper program is a no-cost service provided to employees and members using the program to shop and compare healthcare services. Your clients' employees can save money and even earn cash when they choose the cost-effective care found through the Smart Shopper. So let's talk about how this program works. First, a member will see their primary care physician or specialist, and they make a diagnosis or recommend a medical service. After the doctor recommends a procedure, the member logs into Smart Shopper on anthem.com, the Sydney app, or they can just make a phone call. There they will compare providers, prices, and the rewards assigned for the procedures that they need. From there, the member takes control over the cost of their care and selects the provider that they feel most comfortable with, both in pricing and quality. After the member chooses one of the high-quality, cost-effective facilities found when doing the comparison on Smart Shopper, they will have the procedure done at that location within 13 months of shopping. And once the procedure has been completed, they do not need to do anything further. Smart Shopper receives that information from Anthem, and once the claim has been verified, Smart Shopper will process the reward payment and send it to the address listed on the member's account. So they will receive a check in the mail 6 to 8 weeks after the procedure has been completed. The process is completely automated. The member never has to submit paperwork or apply for the reward. Smart Shopper has been around for us. We've been utilizing this since 2018, and we have gained 1.7 million members have utilized this service, and 65% of those have chosen lower cost options, resulting in significant claim savings. There are over 40 shoppable services covering hundreds of procedure codes. Member rewards with this program can range from $50 up to $500, depending on the service and the location chosen. Let's move a little bit into our well-being solutions. Well-being solutions is designed to improve employees' total financial, emotional, physical, community, and social well-being. The program uses the whole person approach to build a clear picture of each employee's health in areas such as awareness, engagement, and outcomes. A well-being coach total is a flexible coaching solution for motivation and support. This is available to SACA benefit plan link plans, some of the ACA plans, and the 51 plus. This is taking your health and wellness packages to a new level. Wellbeing Coach Total is a new solution for members who need and want to make behavioral changes. It can be accessed through the Sydney Health app or over the phone. There's unlimited one-on-one support from your digital coach built upon cutting-edge AI and health monitoring technology. The app delivers evidence-based care and a self-directed experience that evolves from the data and the interactions. It offers members 24/7 access to personalized coaching experience on topics such as weight loss, fitness, nutrition, sleep, and stress. And please note the digital coaching is only available through the Sydney app. The telephonic coaching obviously is available, anyone can call in on that. But to access the digital coaching, that is done strictly on our mobile app. Live Health Online, hopefully you're aware of this program. It is our live on-demand video doctor visits that are 24/7, 365-day accessibility. This can be done on a smartphone, tablet, or computer. The cost is typically less than or equal to an office visit, depending on the member's plan design. E-prescribing can be done directly to your pharmacy of choice. And now it also includes behavioral health visits with in-network licensed psychologists, therapists, and board-certified psychiatrists. Future Mom's breastfeeding support is also available now with visits with a lactation consultant or a registered dietitian for personalized postpartum nutrition and lactation support. We are now offering a new benefit through Live Health Online, and this is for sleep medicine. The benefit includes consultations with a sleep medicine specialist and at-home sleep testing. The plan's specialist cost share would apply. Any durable medical equipment needed as the result of the sleep testing, for example, a CPAP machine or accessories, are covered as any other DME on the plan and obtained through a contracting DME provider. The main benefit of this is that they are able to perform these at home, the tests at home, and the cost share would be at a copay, a specialist visit copay versus deductible and coinsurance, which would be the typical in the different setting for the sleep studies. Let's talk a little bit about what's happening with our pharmacy. We have a care optimization program that empowers members and providers with actionable insights. We have member outreach via digital notifications and care gap alerts, medical review notes, which are mailed to the member, and pharmacist outreach for diabetes. Telephonic outreach is done to members and providers and includes claim monitoring for gaps in care, adherence, and quality of care issues, with a focus on diabetic members taking more than 10 medications, members taking more than one behavioral health medication, members taking behavioral health medications that may not be age appropriate, and telephonic outreach as needed to help address and resolve any identified issues. The Clinical Pharmacy Care Center is an in-house pharmacy care outreach team and technology infrastructure. And this enables collaboration and coordination of patient care across medical and pharmacy touch points. And there's a pharmacist-driven outreach with medication experts engaging and supporting patients and their providers. And it uses advanced analytics to ensure prioritization and improved patient outcomes. We have proven results in closing the gaps of care and avoiding higher medical costs. Over 3.1 million messages have been sent, resulting in 37.6% of those members that are more compliant with their medications, closing roughly 36% care gaps. Care gaps have been closed, saving $20.4 million in pharmacy and avoided $127 in medical costs. So we definitely are seeing a return on this program. New for 2021, the specialty copay accumulator rule is going into effect. And what this is all non-need based copay assistant program funds applied to the cost of a specialty drug no longer apply to the member's deductible or out-of-pocket accumulators. Only the monies truly paid out of the member's pocket will apply. Previously, the entire amount of the medication would apply to the deductible and out-of-pocket, even when the member did not actually pay that full amount. The pharmacy point of sale rebates apply for 51 plus fully insured ACA and ASO under 250. The member portion of the pharmacy point of sale rebate is 100%. The discount is applied at the time of purchase. Drug claims processed under medical benefits are excluded, and only employees' true out-of-pocket costs will be applied. Sorry about that. Will only be applied to their deductible and out-of-pocket maximum. ASO under 250 was previously out of scope for the rebates. They are now included. But please note that small group grandmothered, SACA benefit plan, and ABF are not part of the rebate program. Okay, now we're going to talk about Anthem Link, and you may have realized that I referred to this earlier. So this is a new product that we are offering for 2021. So let's talk about Anthem Link. You may have heard of it referred to in other terms. This is part of our Blue Connection network. It is a high performance network. It connects members with high quality providers and smarter healthcare solutions. It's a network of high performing providers that offers wellness programs, artificial intelligence enabled digital tools, our whole health programs, advocacy and clinical integration, and OE support and transition of care. As a leader in the healthcare space, our mission is to mobilize all healthcare players such as employers, providers, and members to champion the best in care, experiences, and cost. We can't do it ourselves. It takes a coordinated and aligned approach to achieve this aspirational goal. Given our market share and provider partnerships, we are in a unique position to lead the transformation from fee-for-service to value and risk-based models of care. Our focus is on establishing mutual alignment with providers on business and growth strategies, in addition to enabling them with data, tools, capabilities to effectively manage performance. Our high-performance networks accelerate an industry-wide shift toward better outcomes and value to drive change in a way that only we can do. Our network gives your clients access to carefully selected network of providers who are committed to and accountable for enhancing care quality and efficiency today and in the future. It's designed to deliver double-digit savings. It is accessible in major cities nationwide, and it offers tools and resources to support, simplify, and enhance your clients' employees' experiences as they navigate and plan their care. Our network includes providers who consistently deliver both high quality and low cost. A network can't be high performance if the providers only demonstrate lower cost. Anthem provides consistently delivered both lower cost and higher quality through care that is patient-centered, evidence-based, and appropriately coordinated with transparent measures. Our network quality standards are well-defined, rigorous, and derived from robust claims and utilization data. And we have access to a depth and breadth of data that delivers quality care for members and makes a real impact on the bottom line. In the Cincinnati network, there are only certain service areas that this network is available. In the Cincinnati area, this network is available, and it will be driven by TriHealth and Cincinnati Children's as our anchor hospital and provider systems. Columbus is also an area where we're able to sell this program. However, details on the network will be forthcoming. And please note that in Cincinnati and Columbus, this link program or the link product will be available to ACA, SACA benefit plan, and 51 plus. In the Cleveland market, it's a little bit different. This is only going to be available to groups of 250 members, but the network will be comprised of Cleveland Clinic. That will be the driver of the network in the Cleveland market. But this is not available to the 2 to 99 segments. Anthem Link, the overview of the digital first product design. It includes digital programs, clinical well-being programs, benefit designs and steerage, and also includes the high performance network Blue Connection HMO. On your screen is an outline of a benefit structure for a PPO type benefit. And as you will see, there is a great benefit for the members because the cost shares are so much lower. For example, you can see that there are office visit copays of $0. The benefits were designed to be beneficial to the members as well as the cost savings to the group. And this is a benefit design structure that is HSA based as well. And again, you can see that there's 0 copays. You can see lower deductibles on these types of plans. I am now going to turn this over to Nicole Caton for specialty updates. Following the specialty will be more updates from 2 to 50 and 51 to 99 specific to each segment. So please stay with us.
Thank you, Kathy. Good morning, everyone. I am Nicole Caton, Specialty Sales Executive in Southern Ohio. I hope all of you are familiar with Anthem Specialty Solutions. We are a great choice for standalone ancillary benefits. But what sets us apart from our competition is our clinical integration with medical. So Kathy, if you could go to the next slide. I'm going to go through our clinical integration, which we also call Whole Health Connection. With that, we're able to do 3 important things. That is enhance member experience, improve health outcomes, and reduce healthcare expenses. So as you can see on the right, the statistics show examples of this. We close 17,000 dental gaps in care on a monthly basis. 90% of disease first show signs in the mouth, and some people only go to the dentist. So with our integration, if a member's dentist notices signs of a health condition, it is notated in their profile and then accessible to their primary care provider. Also, hundreds of medical conditions can first show signs in the eyes as well, like diabetes, high blood pressure, or certain forms of cancer. With the bidirectional sharing of information between these providers, all of the members' healthcare professionals have access to their care and treatments. So it helps with earlier detection of conditions and just is more of a proactive approach to managing a member's health. And then 23% of employees' early return to work refers to our disability case managers, working closely with our medical care management staff with information to help members get back to work. And then 50% decrease in opioids prescribed is from the sharing of information with our doctors, so they know when a patient is on an opioid in their plan of care. And then Kathy, you can go to the next slide. I will go over our patient health history. We are the first and only carrier with bidirectional communication between dentists, eye doctors, medical doctors, and care management professionals. So this eliminates the need for self-reported data. Through our provider portal, our doctors will have access to health history, prescriptions, and like care plans for a member. This can help with seeing the whole picture on a member's health and significantly prevent gaps in care and avoid overprescribing. And then on the next slide, this is related to our dental PPO network. We've spent several years growing our network, and as of May 1st, we became the largest national PPO network. So it's our goal to offer the best access to providers along with significant savings, which is around 38% on covered services. So as you can see on the bottom, the statistics related to network size and location. Also, we have the ability to customize benefits. We can offer like teeth whitening or no annual maximum upon request. We also have combined administration. So our clients will have one bill, one portal, and then there will be one ID card for our members. Our ID cards are integrated onto the Anthem Sydney app as well, so it makes it convenient for care and access. And then you can move to the next slide, Kathy. On the dental piece, we now offer teledentistry. All teledental services are paid the same as when a dentist provides care in the office and is subject to the same reimbursements. This is a great option for toothaches, teeth grinding, even emergency situations can be called in through your smartphone. This is a really nice benefit for those who are high risk, disabled, or just unable to go out during this time. And then on the next slide, we also offer ortho at home. This is offering in-network coverage as well through Ortho at Home. A licensed orthodontist oversees care, and there's significant savings through doing this at home. And you may be wondering how this works. So if you've ever had this type of care, you may be familiar with the mold process. This can actually be done at home. The kits are sent to the member at home and then sent back to the orthodontist who oversees the care, and then outliners are sent back to the member. So this again is a nice option for those who prefer receiving care in the privacy of their home. And then on the next slide, I'll go over our Anthem vision information. We do have the largest blend of independent providers in network, but additionally we have a significant amount of retail locations and online providers. We have seen a big shift in people getting their eye exam in the office and then ordering materials online. We see a 75% average member in-network savings and a significant amount of network utilization. Vision also has combined administration with one bill, one portal, and one ID card. And then on our next slide is the life and disability portion. We actually service 3.6 million members and 35,000 customers in our life and disability arrangement. We most recently went through a contract refresh in 2020 and are able to offer many more plan options and customize contract provisions. We can start offering these contracts in 2021. Another benefit is our medical and our disability case managers are able to coordinate care because they're on the same management platform. So now teams are able to utilize medical claims to process disability benefits. So gone are the days of waiting for your physician statement to be completed and sent to us in order to receive the disability check. The coordination also continues from short to long-term disability as well. And then lastly, on the next slide, I will go over our value adds. Our life and disability have value-added services like travel assist and beneficiary companion. But I think our resource advisor is a really nice benefit for members. It's a great resource for those who may need counseling services or support during a difficult time. We offer 24/7 phone consultations and 3 live health online or video visits for members. So this is great for members who may not feel comfortable discussing situations in person and prefer to be in the comfort of their home. We really just want to offer as many possible options to create a pleasurable member experience. And that's all I have to discuss. I want to thank you all for your time and partnership, and I will turn things over to Robin now for more updates. Thank you.
And actually, Nicole, I gave you false information. I am up next again, and then I will be turning it over to Robin. So I do apologize for that. I am going to be going over the 2 to 50 updates, and these are the updates that are just specific to our small group platform. First, let's talk a little bit about our SACA BP. We're going to start out with what is new and exciting for 2021. So the first thing is with our, we have recently made some administrative changes. We've added the miwa.io tool, and that was recently added to help with a couple of things. One is to ensure that information on terminations is correct, so that the appropriate coverage options are provided through SACA or through the COBRA or state continuation. And the second was for groups that qualify for Medicare primary rates, and to notify them of any Medicare eligible employees and facilitate the online completion of the required packages. So we continue to make improvements and ensure the best member, employer, and broker experiences with this tool. Let's move on to some other recent administrative changes. So since we are now using employer access to administer changes on the SACA benefit plan within enrollment, the SBDs and compliance documents are now housed on employer access as well, as opposed to FormFire. So new updates for 2021. We are going to be adding domestic partners as an eligible dependent beginning new business January 1st, 2021, and this will be reflected in our contract language. So we're also making it easier to sell specialty with your new business cases. Beginning October 1st, we will have a template that is available. So this will be made available for your new November groups. This template can take the place of your specialty elections on the FormFire employee apps. So you can submit a template for your life, dental, vision enrollments, as long as we have that information already from the medical piece of it. So if you have a member that is not enrolled on the medical plan, we will still need to have that application. So that's how we can gather the data on those dependents or members for the specialty. But outside of that, all you have to do is submit the template now. This will eliminate the need for employees or you as the broker to go back in and make those selections if the group decides after the fact to add dental, vision, and life. And certainly with the life, you know, it will not be necessary to gather the beneficiary Social Security numbers that is required when you are electing life on the application through FormFire. So trying to make it easier so that you can add specialty without the hassle of going back in and changing the employment applications. We are also going to be offering a combined medical and specialty app for employers and employees, and that will be coming in 2021. We are just waiting on ODI approval for those new applications. We are also going to be changing our welcome letter process. We will be sending out letters upon underwriting approval and won't pend this for final installation or ID card generation. As it is now, those welcome letters don't go out until the group is up and running in the system. We're going to be sending those peak letters out once when that is actually being sent to be processed. So once we have underwriting approval on the final submission, you will receive a welcome letter, and this will allow you to then cancel the coverage with the prior carrier in a more timely manner. Also, in an effort to streamline correspondence, we are making some changes with our sales support staff. And as it stands now, we have different team members that are assigned to different parts of the state. And that is going to be changed so that all members are working that mailbox for the entire state, and it will be first in, first out with everyone. So you may be receiving communications from people other than who you're used to, Shelley, Sherry, or Pam in your area, because we are changing how the processing is going. So everybody will be working across the state on new group submissions.
Kathy, this is Shelley.
Yes.
If I could just also interject there, for all of the Cornerstone brokers, that is actually handled by the new business department. So those are not folks that you regularly receive emails from or have a need to submit anything to that mailbox. You send that still through the regular format. When you send a case in SACA, it goes directly to us, and we handle all of that processing for you. Just wanted to add that.
Okay, thanks, Shelley. We are also going to have a new administrative and benefit change form, adding the contract codes for 2021. So we're just updating that. And in other big news, for January 2022, we are actually going to have 3 renewal dates. We are adding 2 more renewal dates to the SACA benefit plan. We will be adding January 1 and September 1. And please note that the renewal dates are being added in 2022. So for example, if you write a new group, January 1, 2021, they will renew January 1, 2022. The medical contract lengths will now vary from 9 to 12 months, depending on the original effective date. And I like to liken this to the Price is Right kind of theory. So it's the closest renewal date without going over 12 months. They will automatically be assigned depending on when the new business comes in. So January through April will renew January 1st. May through August renews May 1st. September through December is September 1st. So it's the closest renewal to 12 months without going over 12 months. And we will continue to align the specialty renewal with the medical renewals. So big news. We've been wanting to have this for quite some time, and now due to the system changes that we've made and the platform transitions, we are now able to offer those renewal dates. We're very excited about that. So SACA benefit plan portfolio updates. Previously, you may have seen on some of our materials, the plan was referred to as the SACA MIWA. We are now consistently calling that the SACA benefit plan. So we'll read SACA benefit plan PPO Blue Access. We are going to be adding plans, as I had mentioned, the new Anthem Link HMO plans, which will be available in Cincinnati and Columbus service areas. This will include 3 traditional PPO plans and 2 HSA compatible plans. Outside of the Link plans, we're also adding 2 new PPO plans to the SACA benefit portfolio. So we will have a total of 28 different plan options that are available in 2021. We are also making a pharmacy network change, and this is just to align the pharmacy network with what you are used to on ACA and 51+. We are moving to the RX Choice tiered network. So the pharmacy network is now going to be tiered, and depending on where the member receives their medication, which pharmacy they use, will depend on what their copay is. So the level 1 list of pharmacies it includes about 25,000 network pharmacies. This includes CVS, Target, Walmart, Sam's Club, Kroger, and Costco, all of the main players. The ones that it would not include that move to tier 2 would be Walgreens, Rite Aid, and Giant Eagle. So the level 2 copays are going to be $10 higher than the level 1 copays. And again, this is the same as what we offer for ACA and 51 plus currently. ActWise is our integrating your clients' health plans with their spending accounts. We do this through ActWise. This has been available on our ACA plans. We are now making this available with our SACA benefit plans as well. Changes for the SACA benefit plan, the well-being solutions. We will continue to offer our foundational package on our PPO plans. There's no change to that. The Anthem Link HMO plans will offer preventive care incentive package. This includes incentives such as Sydney My Health Rewards can be earned up to $150, or an annual adult wellness exam and flu shot would result in a $50 reward. It includes the Wellbeing Coach Total program that we talked about earlier, digital and telephonic. But please note that our Smart Shopper program is not included on Anthem Link because this is an HMO, it's a narrow network program. Our foundational programs deliver unparalleled value for your clients no matter where they are in the healthcare spectrum, whether the employee population has heavy chronic conditions or very healthy. We offer something for everyone. So with our ACA portfolio, again, we are offering Anthem Link products as part of the ACA portfolio. And again, this will be offered only in the Cincinnati and Columbus service areas. We are going to offer 5 digital care plans, 3 traditional PPO plans, and 2 HSA compatible plans. We are continuing to offer the Pathway HMO in all markets. So that will still be an option for all markets. And we are adding 1 new plan to that Pathway HMO product. With our PPO, we are actually closing 16 plans, including all of our platinum plans. And this is based upon a review of low or no enrollment. So we're just tightening up our offerings based upon where the enrollment is. So in 2021, we're going to have a total of 40 plan options still available for ACA groups. We are also going to be changing our RX cost share on HSA or on ACA plans. The level 2, 3, and 4 copays are going to be changing in 2021. So you can see level 1, it will be $60 for level 2, $100 for level 3, and the per script price has gone up for the level 4 cost share. And then level 2, of course, is $10 additional in the copays, and the per script on level 4 goes up $100. We have also some miscellaneous administrative changes. We have some options for a quick renewal button that will be added to the producer toolbox. And another piece that is important, I think is another good news story, is for our ACA plans, we are no longer requiring the first month's payment via check to be submitted with the new group submission. This will now be collected through the normal invoicing processes. We are not requiring an actual check to be sent in any longer with the ACA plan. So I think that's great news. So our ACA RX program is changing from 90-day maintenance to what we call opt-out home delivery. Members must receive their 90-day maintenance medications through home delivery, which is powered by Ingenio RX or CVS Retail. They do still have the option to opt out of mandatory mail, but they must call into customer service to request that. And here, I think I'm going to turn it over to Robin to talk some more about some updates of what's happening with existing business.
Good morning. I'm Robin Kalp, Account Manager in Southern Ohio, and you might work with my counterparts, either Jimmy, Kelly, Caitlin, or Jackie across the state. So we're going to start off with grandmothered updates. We continue to offer grandmothered plans since transitional relief was extended once again for 2021. There are no portfolio changes except the annual evidence of coverage updates with the telemedicine. Our Luminos HSA plan incentives will remain unchanged as well. So you're still going to receive the $100 incentive for an annual exam and flu shot combination, $50 incentive for tobacco-free certification, and a $50 incentive for online health risk assessment completion. Next, please, Kathy. On our grandmothered renewals, those are going to be released to the producer toolbox, and I've gotten a couple of emails, so I think a lot of those are already out there and have been released. The rest of them should be coming tomorrow, and then the ACAs will follow after that. But we're happy to say that our average renewal increases are about 6% this year, with 80% of them being under a 10% increase. And of course, we always like to preface that as saying that there are some outliers that, are maybe not quite as pretty, but we will work with the account managers at Cornerstone to help you get those down. The brokers will receive the grandmothered renewals on the legacy portal, and then the ACA alternative renewals will also be on the portal for their, pulling off. And that usually happens with the renewal specialists at Cornerstone. They will be presenting those to you. Just remember as a broker that the ACA renewal options are only given to you as the broker. The group does not receive a copy of that, so please share that with them. And then the renewals are going to be mailed to the groups directly about 65 days in advance of the renewal date, which ends up to be around October the 25th. So, you've got a lot of lead time there to hopefully work these renewals out before they even receive their copy. The options
Robin,
for the renewals
Shelley.
this year.
Robin, if
Yes.
I could just add one more comment there. Thank you. So we are in the process of actually sending you now your 12/1 renewals, which popped up initially for us on the Anthem portal. And due to system issues and just the huge glut that comes across at this time of year, the 1/1s are going to start appearing in the portal for us tomorrow. And so Virginia on our renewal team will be working to get those out to you. If you do, the ACA alternatives come separately often, and so we don't get them at the same time. We are anxious to get your 1/1 renewals out to you. So if you do want to see the ACA renewal, we request that you get in touch with your broker advisor across the state, and they will be happy to get those out to you, but keeping in mind those generally are going to be higher in cost, most often than, and sometimes significantly than what you're seeing in that grandmothered renewal, especially with the average increase being presented today. So I just wanted to add that. Thank you.
Yes, and just to piggyback on what Shelley said, the ACA renewals are always secondary. So once the grandmother finish filtering through the system, which like I said, there's a few of them out there, but there's the remaining of them, just like Shelley said, or there's a huge block that's doing it at the same time, but the ACAs will follow, so they won't be released until the next couple of days. So And then the options for the renewals, you can renew as is, and there's no requirement for signed paperwork. You just need to notify your account manager so they know that that's renewing. You have the option of moving to another grandmothered option that's available on the renewal, or your account advisor can run those for you as well. That just needs, the benefits and rates need to be emailed to reclass and a copy to your account manager so they know that that's renewing as well with a plan change. Then you also have the option to move the group to an ACA platform if that would be advantageous. But we ask for approximately 25 days in advance notice in order for us to move that to the other system smoothly. So we need those changes by 12/5, and that would include an ACA acceptance form, benefits and rates signed for that ACA alternative option if it is different than the one that was automatically given as the renewal option. And then fourthly, the SACA benefit plan, if you are interested in maybe moving the group to the SACA benefit plan, you would need to speak with your account manager to see if it's a good fit for the MIWA, because we can let you know if it's not a good fit, and it saves a lot of time for both parties. Next slide, please. Our well-being solutions. So our foundational package did not change. However, there are a few naming conventions that I wanted to mention. They're actually highlighted in green on the slide. So our pharmacy outreach program is now called the Care Optimization Program. That's in the top right corner. Ingenio RX Specialty is now called the Medical Specialty Drug Review, which that's in the third column center block. And then the Ingenio RX Specialty RX Site of Care Review has been shortened to Site of Care, second column middle block. So that's just the only thing that's changed is our naming conventions on our Wellbeing Solution Foundation package. Also to mention on that, that's kind of behind the scenes, under the AIM, image shopper versus clinical site of care, the imaging redirection is done at the provider level during the prior authorization process now. When providers submit the prior authorization, there's a hard redirection from an outpatient hospital setting to a freestanding imaging site when there are those alternatives available. So what this means to the members, they are no longer involved in that redirection process, and the approval for the service will continue to be at the lower cost point of service. So just good news that the member doesn't have to be in any part of that solution. Next slide, please. So our preventive care incentive package, it is going to be available on our Anthem link for SACA benefit plan, as well as the Anthem link ACA. The preventive care incentive builds upon the foundational package that I just went over, but this package includes additional coaching, digital or telephonic, and adds members' incentives to encourage the preventive care behavior and early detection of chronic conditions. This program is very similar to the Get Strong program that is already available in the key segment today. Next slide, please. The Preventive Care Incentives Plus Fitness Package. This is available only to the ACA Plus plans that have the incentives. So the Preventive Care Plus Fitness Package also builds upon the foundational package. That is included. This includes the coaching incentive to encourage the preventive care behavior, as well as the gym reimbursement. And the gym reimbursements are available for the subscriber, the spouse, and dependents age 18 to 26. And the benefit is $400 a year. And what the requirement is, you must go to the gym 50 times every 6 months in order to receive that incentive. But that is quite the incentive, if you're, especially for those who already go in regularly to the gym, but those that are wanting to, work on their fitness, that's an awesome benefit there. Next slide, please. So the ACA Wellbeing Solution changes for 2021. So our Pathway HMO and most of the PPOs will continue to offer the foundational package. The new Anthem Link HMO plans will offer the preventive care incentives package. The PPO plans with the plus in the name will include the preventive care plus fitness package. And then the Smart Shopper is only available, we just want to make sure we reiterate this, is not available to the Anthem Link HMO and the Pathway Group HMO plans. And of course, that's because of the narrow network. Next slide, please. Our small group onboarding and renewals. This is just kind of to reiterate the employer tools that are available. So starting in 2020 for our SACA BP MEWA groups, we included a URL to the welcome kit that is emailed to the group, and this will be continued. But this provides the employer with guides, videos, documents, and more to help them manage their plan and better communicate it with their employees. So that information is still going to be sent. And then with employer access, of course, everyone's very familiar with that with the SACA benefit plan, but that's our online tool for enrollment, eligibility, and account maintenance. So that will continue to be our account management source on the producer toolbox. And so you can see that information there as well as employer access. And that's all that I had. I believe I'm supposed to hand this back to Matt Lapp for the 51 to 99 update.
Actually, Robin, you skipped over Jeff. So Jeff is up next.
Oh, okay. I was thinking, okay, my bad. Jeff Reed from our Connect team is going to talk about our small group specialty. My bad. Thanks.
Good morning, everyone, and Robin, you're forgiven. I understand. I'm the little guy on the planet, so I get passed over a few times. But everyone, really truly appreciate everyone joining today, and we all do as a whole. It's great to see so many attendees to hear about our little changes and updates. My name is Jeff. I work with the Small Group Specialty Department. I work with dental, life, vision, and disability for a group size 2 to 50. And I am here to talk a little bit about some of the changes that we had in 2020 that are active now and will be going active into 2021 as well. But these changes should help you with your fourth quarter business. One small change we made this year was on our vision plan. It's been with our dental plan for the last couple of years, but we do not require any employer contribution for the voluntary and non-voluntary dental and vision plans. The reason behind that is voluntary plans a lot of times are only offered to groups above 5, and well, those 2 to 4 groups that we all know and love, they want to get the benefits for their employees, but because of money constraints, the employer is not always in a position to contribute. We don't want to lock them out from it, so we've offered that now to where they can apply that entire premium to the employee, and it doesn't get into their bottom line. Also, grandmothered and ACA groups, they can benefit from the same discounts that the SOCA benefit plans do by having, if they are a member of a chamber or an association. That's something that just let us know that they're a member of that chamber, and we can give them a 5% discount on dental, life, and disability, and up to a 12.5% discount on vision. That's all going to depend on their chamber contract and everything, but those chamber discounts do still apply to any grandmothered and ACA groups. Also, we do have a $50,000 guaranteed issue on on our life coverage. What that means is that all groups, size 2 to 50, can get up to a $50,000 life insurance policy without having to go through any kind of medical underwriting. We added some new vision plans with higher material allowances this year, 150, 180, and 200 allowances for frames this year, which will really help out in the long run when people are looking at getting those the glasses. Let's face it, they've gone up, so we've gone up as well, and we do still offer the 130 plan option as well. And then we've expanded our dental and vision portfolio for the SACA benefit plan groups. The vision portfolio hasn't been expanded. That's something new coming in 2021. However, the dental one is currently. So if you do have MIWA plans and the rate sheet that we give you does not necessarily fit what they're looking for, all you got to do is let us know, and I can look into it and maybe get you a better dental plan. Kathy, if you could flip to the next slide, please. Just so you can see our faces, keep in mind, my face does not look that woolly anymore. I've gotten a haircut and a beard trim, so I'm not Caveman Jack anymore. But Chelsea and I, we're here to help. Of course, you want to make sure that, and we loop in your Cornerstone rep as well, but reach out to your Cornerstone rep or reach out to us individually, and we can help you with any of the pre-sales through sales, renewals, and quotes. And I thank you for the small amount of time that I had here, but it definitely appreciated. And now it goes to Matt.
Good morning. My name is Matt Lapp. I'm one of the account managers for the 51 to 99 business, what we refer to as Key in Southern Ohio. Kathy, let's jump to the next slide, please. So fortunately, in the Key segment, we don't have a whole lot of changes going into 21, so you're not going to have to listen to me for too long. I've only got a couple of slides here, and these are the topics that we'll run through. So this slide, the first bullet here, flexible rate options. We will, for 1/1, for both new and renewal business, be able to offer extended rates on a case-by-case basis. So if this is something that's of interest to you, work with your Cornerstone rep, and they'll in turn work with us to see if an extended rate might be an opportunity for your particular account. We will be able to offer, again, case-by-case 15-month rate at no additional load, so the same rates as you would get for 12 months. We will also, again, on a case-by-case basis, be able to offer 18-month rates. That would be a 1.5% load, which is about half of what we would typically charge to go 18 months. For new business only, and again, I'll reiterate, case-by-case basis, but on new business, we will be able to offer 24-month rates in certain cases. Also in the Cincinnati market, this is where we get into the transition credits, or I'm sorry, I'm jumping ahead. Transition credit for all new business in Key, where we have the paperwork in 45 days in advance for 1/1, we will be offering a $5,000 credit to those accounts. Again, all complete paperwork needs to be in 45 days in advance. Another credit opportunity in our Cincinnati market, and this applies to both new business and renewal business. If an account were to add our high performance network, the Anthem Link product, and all paperwork is in 45 days in advance, there will also be a $5,000 credit available for that. And then the last bullet here, just a reminder that we have our whole health savings when ancillary business is added. This would apply to both new and renewal business. There's a total of 4% savings taken off of the health rates, 2% alone on dental. So please keep us in mind for those ancillary opportunities. Next slide, Kathy. Some of you may remember in years past, we introduced our level funded product known as Anthem Balanced Funding. It is being reintroduced for January 1. This will only be available at this time for new business. You can see here some of the features of this product. As far as pricing, it will come in at roughly 1% over the cost of fully insured rates. Again, new business only at this time. We will be scheduling some broker webinars towards the end of this month, and I know we're getting close here, so you should start seeing some invitations shortly, but I believe there will be 2 webinars to go into greater detail on this product. Next slide, Kathy. Much like our whole health savings, if you were to add ancillary to the Anthem Balanced product, there are savings that can be had by adding those additional lines of coverage. Next slide, Kathy. Get Strong is our incentive program that's available in the key market. The exciting thing coming in 21 is that we will build this in on all of our fully insured key business. So at renewal, it will take effect for those accounts that don't already have it, and at inception for any new business in the key market. So again, we're pretty excited that we're going to be able to include this for everyone. For those that have it today, and I'll point out the differences because there are a couple of changes going into 21 from how it's handled today. So it'll remain a $200 incentive, total incentive that's available. Currently, you would get to that $200. A wellness visit and flu shot is worth $100. Tobacco-free certification is worth $50, and doing a health assessment is also worth $50. Going into 21, it'll change a little bit. Wellness visit and flu shot will go to $50, and then the other $150 can be achieved by doing various health activities on our Sydney app, health assessment, linking your devices, counting steps, all of those good things. Next slide, Kathy. And then just to finish up my section here, again, not a whole lot of changes, but we do have some changes to our portfolio. Every year we look at it and determine where is the membership, what is selling, what's not selling, et cetera, and make some tweaks based on that information. So as far as additions, we will be adding that high performance network. You'll see here in the Cincinnati and Columbus market, we'll be adding 3 PPO based plans and 3 HSA compatible plans in that network or that new product. As far as plans that are going away, 2 of our current PPO options are going away. 5 of the 3-tier PPO plans will go away. 3 of the HSA compatible plans that we currently offer are going away, as well as 1 of the HSA plans. RX option T5, which to be honest, I don't believe I've ever sold, that is going away. And then finally here, I saw this on a couple of the earlier slides. I will just read through this to make sure that I don't mess it up. Telemedicine mandate. Cost share must align with primary care and specialist care office visit cost share to achieve parity in coverage. Normal primary care and specialist cost share will apply if and when covered telemedicine services are covered by non-Live Health Online providers. And that is it for Key. I will turn this back over to Kathy. Thank you.
Thank you, Matt. That is the end of our presentation, but I do want to note that we have added a lot of slides at the end of this PowerPoint. We call it the appendix, and it is a lot of reference material. And I know Shelley had indicated that this will be available out in their resource center for you to access. So just know when you go out there to look at the PowerPoint, there are additional slides we did not cover today, and those are just reference materials that we felt would be helpful to you.
Kathy, we do have some few questions here, so we'll run through those. And this probably would be good if both segments could comment on this. Can you dual option the Anthem link with a PPO plan? And if so, what are the minimum group sizes? So if you could say ACA, SACA, and Key.
Okay. For ACA and SACA, it is the same. And yes, this can be dual optioned. And for us, if you need a minimum of 3 enrolling to offer a dual option, or 10 enrolled, you can offer 3 different plans.
Okay, and Matt, as long as one person enrolls in the link plan, are you able to offer the dual option, or do you have a specific requirement on your end?
No, it would just be one. Obviously, speaking to renewal business going into open enrollment, we don't know where the membership's going to land. So we're not going to, if we find out that we only get one person, we're not going to pull that plan away after the fact. So, Yep, no minimum. We will be able to offer them side by side.
Okay, perfect. And next question, is there a specific enrollment election template for specialty for SACA, or will they use the one that you referenced, Kathy?
The one that I referenced is going to be the template that has to be used, and that will not be available out on FormFire until 10/1, so it's not out there currently.
Okay. And I'm going to ask this question 2 different ways because I'm not sure if they maybe typed the wrong year. So what will be a renewal date for SACA groups sold with a November 2020 effective date?
None of the changes for renewal dates go into effect until January 2021 business. So if you sell a November 2020 group, it will renew 5/1/2021 still.
And then a November 2021 group would renew if sold on November 2021.
Yep. Yes, September. Yep. It would be, so if you sell a group November 2021, you would go to the next renewal date that is closest to 12 months without going over. So that would be September.
Of 2022, correct?
Correct, yes.
Okay, great. Any other questions, folks? We have covered all that are in the chat box at the moment. But if you do have any other questions, I know we'll all be anxious to see the plan grids with the changes. Note that Kathy indicated we will put the presentation on our resource center as well as a link to the recorded version of this in case you need to go back and re-listen to anything. However, some of those handouts that we normally have accompanying the presentation will not be available until like that first week of October. So please be patient while we get those from Anthem. They finish those up and are able to distribute those to us, and we'll put those out in a Monday Minute, likely our weekly newsletter, as well as put those in the Resource Center for you on our website. We want to thank all of our Anthem hosts and hostesses this morning. Thank you. Great updates. Appreciate all of the information, and a special thanks to all of our brokers here at Cornerstone. We do appreciate you tuning in with us this morning. We have 2 more carriers lined up for next Monday to finish or round out our webinar series, getting us ready for the 4th quarter. But if you have any questions, please reach out to your broker advisors in the meantime, and we do appreciate your attendance and doing business with us here at Cornerstone. Have a great fall week. Wonderful weather in Cincinnati. Don't know what the rest of you have out there, but it's a beautiful day. So have a great week. Thank you very much. Bye-bye.